Welcome, Dr. Baird. Thank you so much for being on our Spotlight series here for the best in pelvic health in Utah. I'm excited to have you on here and excited to jump in and dive into all the questions that we have for you.
All right. Well, thanks for having me. I appreciate the opportunity.
Yeah, absolutely. Kate, first off, kind of tell us a little bit about what made you decide to be a doctor and the route that you went and how, like, the course of history has taken you to where you are today.
Yeah. So I've wanted to be a doctor ever since I can remember. I was probably 8 or 10 years old when I started dreaming about being a doctor. So it's just kind of a lifelong goal. And when I completed medical school, I decided to do family practice, which gave me the opportunity to do a wide range of things. I remember in school, you would do a rotation and I'd do pediatrics, like, oh, I love working with kids. And then I'd deliver some babies and I'd go, oh my gosh, I love delivering babies. And then I'd do dermatology and it's like, oh my gosh, skin is really cool, you know? And so I ended up liking all these different things. I thought, well, family practice lets me do all those things, you know? And so then after residency, I just hung out a shingle and opened up private practice and was in private practice for about 15 years and just saw the typical run-of-the-mill family practice. I did kind of like the old school family doc. I would do home visits, I did surgeries, I delivered babies. I got into a lot of skincare and cosmetic stuff. Just those things that I really enjoyed. I grew that part of my practice and and then over time, uh, became frustrated with the hospital system, the insurance system, the trend of medicine, which is usually just prescribe and throw medicines rather than try to solve problems. And so, in your world, that would be recommend things like pelvic surgery as opposed to just some, pelvic floor therapy, which can solve 90% of the problems or more, and so this jump to let's just throw drugs at you, let's just do surgeries, let's just do procedures, and we'll never really address the underlying problem became super frustrating to me. Um, so probably 15 years ago, I stopped doing deliveries in the hospital and shifted to out of hospital deliveries and helped take care of moms out of the hospital setting. Um, I've made this shift from just prescribing medicines and the typical way medicine approach to more of a functional medicine approach, which is to find the underlying cause of the problem and try to treat that, try to help keep people healthy. Insurances don't really like to reimburse for any of that, and so it has shifted to a non-insurance based practice, which is frustrating because I think insurances should cover this stuff. I mean, it's certainly the healthier medicine approach, um, but they don't. And so, in effort to make that affordable and reachable, we established kind of a concierge medicine approach where people can come to our office and pay a flat fee. An adult would pay $75 a month and then get unlimited visits during the month for just a $10 copay. And then children can pay $10 a month and get unlimited visits with just a $10 copay. So that's often cheaper than what they would pay with their copay or their deductible. Um, but it allows them a membership and access, and then they get all their office visits and stuff for free. And if we have to order any out of hospital tests like an x-ray or a blood test, then their insurance company would pay for that. Uh, and if they don't have insurance, then we have arrangements made for some really cash paid discounts that make that all affordable. So part of the goal is to make medicine affordable, And another part of that goal is to not be driven or mandated by insurance companies saying you have to do it this way, but we can actually just practice good medicine, not insurance-based medicine. Um, and so that's kind of been the evolution of the practice. I still do a lot of pediatrics. I still do deliveries. I do lots of skin care work. We have 7 or 8 different lasers and liposuction and different uh, treatments there that for that cosmetic world, if people like that stuff. But then have gotten into the regenerative medicine as well. So we do a lot of PRP treatments, which stands for platelet-rich plasma. The idea behind those treatments is you're stimulating your body to recruit stem cells uh, to go and heal whatever the problem is there. And we could talk for hours about PRP, but we are the only practice in Utah that is certified to do a method called perfect PRP, the trademarked method that stimulates 800% increase in stem cell recruitment. And so it's a specialty type of PRP. Basically, the big picture of PRP is we draw the patient's blood, we spin it down, we separate out the nutritional factors, platelets, and other things that stimulate stem cells to heal, and then we put that back in the body. So um, there's not any foreign substances put back in the body. It's just 100% natural, but promotes healing. And we do a lot of stuff in your world, in the pelvic floor world there. We have a laser that does stimulates collagen tightening and production in the vaginal wall that can help with stress urinary incontinence. And then we do PRP injections that also can help, especially with scarring. If somebody's had trauma from a delivery and they have a point of scar tissue or anything there that is contributing to their pelvic pain, or other aspects as well. We can use PRP to really help treat those things. So we dovetail a lot with practices like yours, where we aren't the gurus in the physical therapy aspect, but we can help do that regenerative medicine piece and then turn it over to you guys to work your magic with the physical therapy side. So anyway, I love doing a more natural based medicine,
Yeah.
being able to help people that way.
Cool.
So,
What do you feel like makes you and your practice different within all of these things?
you know, I think there are a couple of things that make us different. One is um, I part of my philosophy is I should educate the patient and help them make good choices. So I'm not the kind of doc that you come see and I just write a script, say, hey, go do this, see you later. We spend a lot of time. The average length of our visits are probably 45 minutes to an hour. So there's no rush in and out to see somebody. You will know all the different treatment options and then the information needed to make a good choice. Um, I don't pretend to know it all. I have no problem saying I have no idea, what to do here. Um, and so I'm really just straightforward. If I know it, I'll say, yeah, I know this and I know it well, or I'm not sure, or I have no idea. Let's send you here, to these people that this is their guru, their thing to do. Um, so I think that's also a little bit unique in that I'm not afraid to just say it as it is.
Love that. Okay.
So,
Who would you say is an ideal fit for you as a patient?
I think the ideal fit is somebody who wants to take control of their health, who wants to do um, that holistic approach that says I want to take charge and I want to be healthy and I want to prevent illness and I want somebody who'll be just honest and straightforward about that. We have a wide range of clients and so it's like little niches, little and and so for deliveries, there's certainly an ideal client for that type of delivery, and there's an ideal client for the typical family practice stuff, and there's the ideal client for regenerative medicine. So that's another thing that sets us apart is that we do so many different things
Mhm.
um, that we can cover this wide spectrum of needs for clients. So.
Awesome. Okay. What does the process look like to work with you and your company? Like, how does someone just call? Do they need a referral? Do they just show up on your doorstep? How do they work with you?
Yeah, either way. The most common is you just call and make an appointment and come in and we talk. We frequently do free consultations so that people can get to know us and feel comfortable. Um, I didn't mention it, but in the functional medicine and regenerative medicine world, we do a lot of hormone balancing.
Mhm.
So, and we do bioidentical hormones for that for both men and women. Um, but typically, it's just make a phone call, call us, make an appointment, come on in, and we visit. And then you have options. You don't have to sign up for that monthly membership. You can just, pay per visit if you want. Um, and we have people that do both, and it's all reasonably priced stuff. So.
Awesome. Okay. Let's switch gears just a little bit here. And what would you say that recovery looks like through your lens of practice, whether that's someone who had a baby or maybe they're transitioning into perimenopausal, menopausal, and they're wanting to do some of the hormone replacement? What does that quote unquote recovery look like after a procedure, after hormones, after delivery? Like, kind of give us the little gamut of what your clinical ethos is on that.
Yeah. So we really focus on maintaining wellness and doing those things that help your body recover. So depending obviously on what you're recovering from, after having a baby, a portion of that is trying to get sleep, even though that's super difficult with a newborn baby. Um, but we incorporate diet, we incorporate sleep and exercise and lifestyle routine, and uh, and we try to really just promote that
Okay.
maintaining wellness approach. Most of our procedures don't really have a downtime, significant recovery. The exception to that is liposuction has certainly a longer downtime, but things like PRP, there's very little to no downtime. Um,
That like a
uh,
day, 2 days, 2 weeks.
like an hour or two.
Okay,
I mean, a lot.
perfect.
Yeah, yeah. I mean,
I
it's
figure
just like
our audience will have those questions of like, well, how long is not very long?
yeah, yeah.
Now,
How long is not very long?
yeah.
Yeah, most PRP treatments you can resume normal activity that same day. You can have PRP to the for stress urinary incontinence, and the studies that have been done um, with PRP, this perfect PRP method in stress urinary incontinence, has 97% of the people after one treatment have significant improvement, and over 90% after three treatments feel like the issue is resolved.
Amazing.
Now, that's certainly there's a specific client that meets that criteria. If somebody doesn't have a huge prolapsing problem,
Great.
you have to fix those issues outside of it. But anyway, you can do the PRP treatment and leave the office and resume normal activity. There's no downtime.
Amazing.
And yeah, most of it, the downtime is less than 24 hours, and usually
Perfect.
you can just go about your day right afterwards.
Perfect. Perfect. Okay, my next question for you is what's something that most people don't know that you think that they should know?
Oh, wow. I think most people don't know that they're kind of being fed a lie or a message in the medical world,
Perfect.
and they don't know that you can prevent 90% of the problems with just taking charge of your diet and your lifestyle. we have a huge problem in our country, and with diabetes and heart disease and stroke and cancers and you know well over 90% of everything you go see your doctor about could be prevented, and there's no reason for anybody to develop type 2 diabetes, for example, and blood pressure problems and and so there's so many things that we can do. And right now in medicine, the solution is, well, I'll just throw a pill at you for this and a pill for that, and rather than addressing the underlying problems. And so I think that's what most people don't know, is that there's actually solutions, not just medicines, and that you can be healthy. It takes some discipline. It's
Not
not
easy. It's not
easy.
the easy
You
route.
gotta, yeah, you gotta be responsible. You gotta be an adult. You gotta.
All work is hard. You either work hard at curing your sicknesses because of your lifestyle choices, or you work hard on your lifestyle and maybe not have to deal with some of that stuff, right?
Yeah, yep.
Hey, awesome.
So,
Is there anything special that you want to promote to the audience watching at all?
we would love to support your clients, and if you had clients that you felt like could benefit from PRP uh, treatment or laser treatment, if they mention you and this little video, we'd give them 50% off their treatment when they came in, and we'd do a free consult for them and help them understand
That's
how we could potentially help them.
Yeah, thank you so
So,
much. Awesome.
yeah.
And then my final last question that I love asking everyone is what do you want to be known for?
Um, Professionally or just in life? I think those
Let's
are
do
two
both.
different questions.
Let's do both. Yeah, both.
In life, it has nothing to do with medicine. I want to be a good, honest man, a good, loving father. I want to be Christ-like. I want to just be known for being an overall good, caring person.
Love that.
Um, as someone who tried to do what was right in spite of whatever adversary was there.
Mm,
So, as far as professionally, I would like to be known for someone who was loving and caring, who listened,
mm,
and who explained things clearly and gave good, viable options that were tailored to meet the patient's needs
amazing.
in whatever area that is. So,
Amazing. What a good end to the Spotlight series.
yeah,
Okay, where can we find you, Dr. Baird? Website, practice, phone number,
yeah.
social media, and all of the above.
So we have two different websites. The family practice website is called Helix Springs. It's just helixsprings.com. All of our regenerative and cosmetic stuff is under V Gentle, the letter V like Victor and the word gentle,
Mhm.
vgentle.com. But our phone number for both places is the same. It's easy phone number. It's 801-796 and then the word baby or 2229. So 796 baby. And we are on Main Street in Lehigh and would love to have people come by and visit us
Just down
and
the
work
road
with
from
you.
us.
Yep.
Awesome. Well, thank you so much, Dr. Baird, for your time on this Spotlight series. It's been a pleasure chatting with you again, and we look forward to collaborating in the community with you.
Well, thank you. And we hope to work with you and your patients as well. So that would be great.
Yeah.